Kelly George here. It's been quite a while since I filled you in on my multiple sclerosis journey and the Lemtrada infusion treatment that I've just had done as well. So I need to do a huge backup. So whether you've been following my videos, thank you very much if you have actually subscribed to the channel as well. I've noticed quite a few people have been doing that in the last couple of weeks and months. And also I've had quite a few people messaging me their story. So it's been really, really interesting. So keep them coming, and slowly I do try and reply to everybody. It's been a little bit hectic in the last couple of months, so I haven't been replying to anyone through the comments on YouTube. So I do apologise, but I am slowly trying to get through them. And I'm also a busy mummy too. So I've got my 3-year-old and now my 9-month-old baby boy to think about, as well as getting myself back on track health-wise. So the last video, I was on my last day of year 1 of my 5-day Lemtrada infusion. Just to recap, Lemtrada being my treatment for multiple sclerosis that I was diagnosed with 2 years ago. I've had a couple of relapses with that diagnosis, and then my neurologist, my MS nurse, everybody had come to the conclusion that Lemtrada would be a very good route forward. It's still very much in the early stages in the UK, so we are treated new patients to this, and almost, I would say, possibly the word guinea pig, because a lot of advice you're given during Lemtrada and then when they sign you off from hospital can contradict some other stuff that you are then told later on down the line. For example, the Lemtrada diet. So the Lemtrada diet is a diet you just have to be careful with what your food and drink you're consuming, very similar to the pregnancy diet. So to avoid certain foods that you could possibly get the Listeria bacteria from, and if you get a bad infection from bacteria, you're going to really struggle to fight it off, because the whole point of your Lemtrada infusion is that you have really killed off quite a large part of your immune system and some certain blood cells that you are now trying to regain and regrow back. So if you get quite poorly, it can be quite affecting, quite damaging to you. So if you do get food poisoning, for example, or any kind of bacteria within your body that your body just rejects and can't handle, you're really, really going to struggle to get over it as quickly as you would have done before you have part of your immune system taken away. I did my 5 days. My last video was day 5. I had the rash, which is what I wanted. If you've seen the other videos, you'll know what I'm referring to. The rash was just an outside body sign to show that I knew something was going on inside. The treatment itself, the actual 5 days of Lemtrada, wasn't hellish. It wasn't nice, it wasn't comfortable. I got hot and itchy. The rash came out and that made me itchy and uncomfortable. It did also cause me to be a bit sleepless nights, even though you're really chronically tired. So that's really weird that you can't sleep but you're really overtired. I was an outpatient at Southampton Hospital as well. So my husband was driving me in every day for the 5 days and then coming back to pick me up every evening. That was stressful regarding family arrangements, who's going to have the children when he's doing that. I also couldn't be around anyone who was sick or poorly or ill. The last day of the infusion, I then got signed off from hospital. You get given a little bag of goodies, and in that bag of goodies is your contact number, what to do in an emergency, because you've come out of hospital on a Friday. So on a Saturday or a Sunday, when your local doctor's surgery is closed and your MS nurse might not be working, what would you do? So you get a contact number. I'll go back to that in a minute. So paperwork saying what you can and can't eat regarding this Lemtrada diet. If you started Lemtrada a year ago in year 1, because it's a 2-year course, people then weren't advised about this Listeria diet to follow. So that was quite confusing, because a lot of people have written to me and said, well, why are you doing this Listeria diet? I did Lemtrada last year and I wasn't told to do any kind of Listeria diet. It's because there was a fatality in a hospital for a patient that had gone through Lemtrada. Following that, they got the bacteria Listeria, and unfortunately that was not a good ending for them. So now, because of things like this, and because it's such a new treatment and new drug, they're now going, whoa, 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 whoa. MS nurses are advising that we now follow this diet. So we're advised about that when we leave. We're given this contact telephone number, which was completely irrelevant in the end, because I did get ill afterwards. And then following that, you also get, going back to this bag of goodies, a load of pee-pops, because you now have to do urine samples for every month for up to 5 years. Once this treatment is over, and remember I've got a year 2 to do as well, which is a 3-day infusion, because my year 1 that I've just done is a 5-day infusion. So you then get given all your urine sample pots because it's easier for you to have those pots. You can actually write your own labels on them, stickers, say who, the date that you've done it, and who it's going to be tested for. There's a lot of side effects that you can get from having Lemtrada. You are completely clued up on this when you have your meeting about, do I go for this treatment or not? So your MS nurse really does fill you in on this. Then the hospital that are going to treat you, they also fill you in on this. And then your neurologist, because you have to sign all the consent papers. So you do know all this anyway. So on your 5th day, when you're released from hospital, whether you've been an outpatient or not, or say you've been in the hospital the full 5 days, you do get the same paperwork, and they do say what you should and shouldn't do, really, and the guidelines to follow. Urine pots is one of them they give you. They give you your own dip sticks, so you can actually dip your urine, and they tell you how to read your findings correctly, your pee correctly, and what you should be looking out for. Thyroid problems can be quite a thing. Up to 30% of Lemtrada patients, I believe, do contract some kind of underactive thyroid is the most common one, but you could have overactive thyroid as well. So a thyroid problem, up to 30% of patients with Lemtrada have so far. Another thing that we have to do is monthly bloods, and you get told how to fill out your blood forms, what to do. You can either go in monthly to a hospital, have them done that way, and then tell them what you're being tested for, because you really do have to educate people within the practice of this amazing treatment that you've had done, because not many people actually know about it. They do tell you to also inform your local GP on Monday morning. So I've come out on a Friday after my 5-day infusion. On a Monday, I'm meant to then go to my GP and actually inform my GP about the Lemtrada infusion that I've had, treatment for multiple sclerosis. So there's a lot involved. So you have these monthly bloods for 5 years. You have your urine dipped for 5 years monthly. And you're given all of this to take home. The only problem was this contact telephone number I was given. Big black bold number, call this number. It's not your direct MS nurses, it's a team of MS nurses. Well, I got poorly. I got home by 4:30 on Friday. By about 3:30 in the morning on Saturday, I was heavily vomiting. I had diarrhea. It was bad. It was really bad. I couldn't keep down water. You're also given some drugs, medication to carry on taking as well. So some antihistamines actually to take in case, that rash really flares up and you can't have it through the IV in your arm anymore because you're not in hospital anymore. So they give you some oral antihistamines to take. They also give you some other oral tablets. Wow, I can't remember now. Anyway, I couldn't take this medication because I was throwing it up. There was another medication I had to take in case I got a viral infection, so anything cold sore related really. And I had to take that tablet twice a day, morning and night, for the next remaining 31 or 33 days after Lemtrada treatment. I couldn't keep that down. I couldn't keep down my antihistamines. I also was trying to take anti-sickness tablets that we rushed out and had to buy from the chemist because I was so ill. I couldn't go anywhere. I couldn't even keep those down. I then thought I was going to be dehydrated. So we had this massive issue on our hands that I was seriously ill. Luckily, there are Facebook groups out there. So we, of course, call this phone number straight away because we've been advised to do that if you have any problems following the treatment. No one's picking up. It's a Saturday. Obviously, we didn't call it 3 in the morning. We waited until possible hours, opening hours, that anyone would be there. But no, all day Saturday, nobody was picking up. We then try and call my GP, which would be a little bit pointless, really, because the GP doesn't understand my treatment because I've been told to advise my GP on my treatment on Monday morning. Anyway, the GP surgery is closed. It's the weekend. We are now contemplating what on earth are we going to do. I am really ill. I can't go from lying to standing up, which I was having to do because I was vomiting so much, without vomiting. I needed to go to the toilet because I had diarrhea extremely badly. I was trying to run to the loo and throwing up at exactly the same time. It was tough. It was tough times. This continued actually until Sunday night, Monday morning. Really, really long time. Going back to the social media and the Facebook groups, it was kind of that kept me going because I felt like I was in contact with other people that have gone through the treatment and obviously my condition of multiple sclerosis. So I'm on the Facebook group, so is my husband, and we're asking advice. So there's got loads of different types of multiple sclerosis Facebook groups out there. I was advised through a friend of a friend who'd actually already gone through Lemtrada. They were one of the first ever guinea pigs because they went through it last year in year 1. So they'll now be going through their year 2 3-day infusion, to follow these Facebook groups. There's a UK one to follow, there's an American one to follow, but they're really good because you can talk to people like yourself that have gone through this Lemtrada infusion that is so unique and so different and such a powerful medication, really, to try and stop multiple sclerosis in its tracks from developing even worse and worse and worse as the years go by. So you're talking to current patients of Lemtrada on the Facebook group. It's great. So I'm chatting away saying, is this a side effect? I was not told that I would get this ill and this sick as a side effect. I've been told to look out for liver problems, kidney problems, thyroid issues. This sickness and diarrhea, this to me feels like a stomach bug. It feels like something similar to the norovirus. Really serious, but I know I've got no immune to fight it off. So I'm going to really struggle. A lot of people commented and said, I did feel sick, but I didn't throw up. I wasn't physically sick. We think you've got a bug. So a lot of people were commenting on my post saying, get yourself to hospital. Then there was this huge contradiction of opinion because a lot of other people were saying, don't go to hospital. It's the worst place you can go. So on a lot of my information I was given when I was released on Friday was from the hospital, was not to go near an A&E department because of germs, bacteria, bugs circulating on air conditioning, and also not to go to crowded places. Don't go to a supermarket for a good couple of weeks. Don't go to a festival. Don't take yourself to, a bar or a club or anything. Not that you'd want to, because you'd be absolutely shattered and you are a patient and you are recovering. But not to go to crowded areas with air conditioning, airports, aeroplanes, anything like that. So the thought of going to a doctor's surgery or an even worst case scenario, an A&E department because I'm really ill is awful because I'm constantly antibacterial in my hands. I'm contemplating if I go to someone like that, do I have to wear a mask? You're at that stage. So I'm really ill. We just got through the night. We tried to call doctor's surgeries. I tried to call 111, the medical service. It's difficult because they're trained to ask you certain medical questions, but no one understands the treatment that you have had. So it doesn't really make sense to anybody. So we get to Monday morning, then I have all the multiple sclerosis nurses calling me back. Luckily, I got better. I had a doctor come out on the Monday. She managed to prescribe me some anti-sickness oral tablets, which I actually kept down. Once I can consume them and keep them in, because the sickness had actually stopped, even though I still felt sick, then the tablets began working. Since then, the MS nurses have actually apologised and said, we didn't even think about this. We've given everyone a contact number to call the minute your infusion treatment finishes. But if you're in year 1, it's always going to be 5 days. It's always going to start on a Monday and it's always going to finish on a Friday. Then everything is closed for the weekend. So if you get really poorly, you can't get through to anybody. The advice I would give anybody now if they're going through this is you can call the direct infusion ward that you had your treatment with. So don't call the A&E department, don't call 111 because they don't really get it. If you can get through to your GP, great, but they might not understand your treatment either. Call the ward that you were in. So if you're an inpatient, call that ward and you might get through to somebody there, someone who's perhaps working the weekend. Or call the infusion clinic that will be next to the ward. And as an outpatient, I was part of the infusion clinic at Southampton. I would have been best, knowing now, to have called them and I would have been able to get through to somebody. The weeks that followed were quite good. So it took a long time to get over a sickness bug, longer than I would say the average person. Add on maybe an extra 5 days to a week. So where you might recoup in a week, it probably took me at least 2 weeks. I really had no energy. The sickness stopped, the diarrhea stopped. I could keep water down and then carry on taking the medication that I've been signed off with.